Welcome back to News in Focus. Oh, we went for break and we were talking about road accidents, actually road safety for children. And here with me is Baby Ann, the brother, like I promised earlier on, joined us on set. But sadly enough, he doesn't look like he wants to speak to me. Why do we have Junior on set?
Unfortunately, we had a hit and run scenario. Some reckless driver hit Junior and disappeared. So we found Junior lying by the roadside.
Okay, if only Ann was big or grown up enough, she would be crying. But yeah, so what are we going to do for Junior now that this has happened? It's very important because in as much as we would want to say that we want to be careful so that we don't, we reduce the number of losses of life, lost in road accidents, or maybe having people going to hospital and all that, injuries and all that. If it happens, what do we do? Okay. Especially for the children.
So Barasa and I will demonstrate what to do in case of this. But Linda, we have to accept many people get scared at the sight of blood.
Yes.
Okay?
Yeah.
Even those in medical practice like us, the first time you get into a theater, when you see blood.
You see, I've seen Junior, and for a moment
yes.
I was like, this is not what I expected.
You'll always want to run away. But then just remember, if you run away, this child has about 10 minutes of life if you do something about it. Yeah. If you don't, then they might die. So just consider running away from blood or giving this child a chance to live. And
okay, Sawa. My question is, do I start getting something to cover the blood, wipe the blood away on it so that we can have Junior survive?
Okay, so what we want to actually demonstrate is sometimes what worries is not what is going to kill this child first. So when we have these cases, what we want to inform you is that you treat first what kills first. So manage first what is likely to kill little Junior first.
I want to believe that mtu akitoka damu, the blood oozing out,
yes,
you go and cover the place.
It's very important,
yes.
very important to think about that, and we are going to see how to manage that. But then there's a systematic way that we can do it that all of us will remember, and we want to make it so simple.
Okay.
But first, think the most important thing that all of us should come to think about is safety. Yes. If you are not safe, please do not approach. Do not tend to help.
Oh,
yes, your safety
like
is
Junior
more.
Has been hit.
Yes, your safety is more important than Junior's safety. Just consider, you are walking on the highway and you see a car run over Junior. Let's say Thika Superhighway. It has more than 4 lanes or 4 lanes.
Yes.
And then you wail and run because you want to go and help Junior.
Yeah.
But there's another driver who is coming from town who probably is on their phone or drunk.
Yeah.
They won't see you. You'll also be run over. So how many lives will we lose?
Two.
But we want, if we have to lose a life, let's just lose one life.
Okay.
Let's just have one life lost.
Okay,
and then we can protect the other life. So safety is always important. Safety in terms of where you are going to attend to this child, is it a safe place? If, let's say, it's a car that crashed into a building and there are still some parts of the wall that are falling, if you try to go and help this child, the wall can fall on you and you'll still be a victim. So look at the environment. If the environment is safe, or maybe just consider, like now we know terror alert is really a problem in the world. Okay, so if there's an active shooter and they shoot a child down and you run to rescue that child, chances are that you also be shot. So just ensure if it's not safe, do not go. If it is safe,
I'm imagining this is my baby, this is Junior, not just Junior, but this is my kid.
Yes, safety is very important because it's your kid, yes, but just consider you have other kids, you have the ability to give back to other kids. What if another car runs over you and crashes you? Now you project your husband to several losses, your other children, they need someone to take care of them. And of course, our country needs you.
Okay.
So I want us to go back to our primary school, the letters of alphabet. That's how simple saving a child's life at home is.
Yes.
And we were taught the first 2 letters are connected. Which is the first letter of alphabet? Letter? The first letter of alphabet is letter?
Go like A, B,
letter
A, yes.
Letter A. So
nowadays they say Abacada.
Okay. So letter A.
Let's go with A. Okay.
Yes. Yeah. So the first letter is letter A or letter A.
Yeah.
Then the second letter is letter B.
Yes.
Letter A and letter B simply mean, is the child able to have air going in their lungs, and are they able to breathe? So like we said, A and B. So we said when they fall down, because their head is big, their head will actually bend. You can see that on baby Anna actually lie on a flat surface. So when the head bends, the airway, this thing that we have, the throat, becomes like a bent straw. So if you are drinking soda from a straw, can you get the soda out? Definitely no. Okay, so we have to ensure that this airway is open. And because sometimes we rush in crash scenarios, we want to pull these people out. We have seen many children on wheelchairs. There's something important called their cervical spine. Okay, it's called the spinal cord. We want to preserve it. One of the reasons why we kill our spinal cord, let me just have baby Anne to demonstrate something.
Yes.
So children are like baby Anne. So if they were trapped inside a crashed car, and then you want to get them out, what is going to happen is if their head gets out, it's going to go like that.
Yes.
Okay? And remember, your spinal cord is where the brain talks to the rest of the body. So if you break it, it means the brain will talk, but the body cannot listen to what the brain is saying. So if you tell them, raise your hand, they will be paralyzed. And these are the people we have on wheelchairs.
Yes.
So we need to think about safety of their necks. And how can we do this? We said also their tongue are bigger and the mouth is small. So we want to get the tongue out of the throat, if in any case it was back in the throat. So we put our two thumbs on the bone on the cheek, okay? Then the other two fingers on the edge of the jaw, okay, where the jaw ends. And then we try to pull the jaw out, just
a little,
pushing it out without moving the head, because we don't want to break the neck. So we just push it a little. If you can see, if our cameras would be able to pick that, then you can see the tongue actually moving out.
Oh, it's moving.
Yes, so it opens the airway. Then once we do that, because at home, you know, sometimes we don't have, in the hospital, when the medical team comes, we have something called a cervical collar that we will put. But at home, you don't have it. What can you do? You can use unga. We all eat ugali, okay? So we can use the packet of ungas, let's say 1 kg, if you have them somewhere, or you can get them from a nearby shop. We expect these crashes to occur near shopping centers. Then once we pull that, we can just apply the unga on both sides of the head. We are going to see how to do it to support that mouth open.
Wait a minute. Junior is still bleeding, maybe somewhere else.
Yes.
So that is what we're supposed to do first.
That is what we are supposed to do that first, because we are going to go systematically and get to the bleeding. Because let me just give you the essence. If I started doing the bleeding, okay, stopping the bleeding, but Junior is not breathing, then I'll have a very nice blood in the body of a dead person. Because your brain, the brain of Junior, will die in less than 8 minutes if they are not breathing. And we've had heart transplant, we've had kidney transplant, we've had liver transplant, but we've never had brain transplant. So if your brain is dead, you are good as dead.
Okay,
so that's why it's important to always check, are they breathing or not breathing? By opening their airway, then Barasa now will apply for us the collar. Okay, so remember, if you don't have this, definitely you don't have it at home, but you can use the sandbags. You can use the unga packet. Yes. Okay. So this is just to support the airway open and also to let the tongue out of the throat, plus to make the neck stable. Because remember, the neck can also, apart from just moving like that, it can also move like this. Okay, so we don't want that still, it would break it. Then, now we can proceed. So we have done our first 2 letters of alphabet, letter A, Ba, or A, B. Now we go to the 3rd letter of alphabet, which is letter C.
C and
or,
D. C. We're going to C, yeah?
Let's stick to C. So letter C, we are interested in how the blood circulates. And now the issue of bleeding comes in. Yeah, that C means circulation. Circulation is how the blood goes around the body. So if we are losing a lot of blood, this child is going to go into what we call shock. So we need to stop that bleeding. And there's a way we can do it. Then in that C also, there's something, if they are broken, and we left the broken part continue moving as we move them around, it will cause more blood to come out. It will also cause a lot of pain that eventually can make this child to crash and die. Okay. So what do we do in C? Now we can see little Junior had a fracture on the leg. Yeah. So at home, regardless of what you have, I know ladies always have an extra piece of cloth. And the good thing about Kenyans, they will always run towards that side to help. So just borrow a piece of cloth, we can tie it, or you can use the child's own cloth, because their life is more important than their nakedness. So you can tear their piece of cloth and pack into that part that is bleeding. So Barasa will demonstrate to us how you are packing. Okay. So packing, remember, you are putting that piece of cloth with a lot of force into that wound. You'll feel, but pain is less dangerous than death. You know, death is the only thing we cannot reverse.
Yeah.
Yeah. So you pack it. Once you pack it, then you can use another piece of cloth
Yes.
to
I have one.
wrap it around. Okay,
one.
so that whatever things you have packed, and make sure you don't just put it softly, put it with pressure inside that bleeding part.
Make it look as like it's something very comfortable to do.
It, you know,
It's not.
here your worry is not about the pain
The
or
pain
discomfort.
of what? It's
You really
about
want to
saving
save
a
this
life.
life, and you have to make some sacrifices. I know it's scaring. If you can't do it, please call
Let
someone
somebody
else to do
else
it.
do
And that's
it.
why Barasa mentioned we need to have everyone trained at least on basic life support, so that not only my house help, not only me, but even the makanga or even the road user, any other road user has these simple skills.
Yeah.
Because if it's my child, I'll be so scared to do this.
Yeah.
So I might just ask
Somebody
the
else
next
to
person,
do
because
it.
they are trained, they will be able to do this. Okay, as I'm on. So once you secure that, which means the bleeding is managed. Remember, it is not completely stopped, but you
It
have
is
reduced
managed.
it.
Yeah.
So we need to reach the hospital very fast. Then remember, he has a fracture. The bone is broken. That bone, when it is broken, it means it will cause a lot of bleeding or even more pain. So we do what is called splinting. We want to support the leg so that the leg behaves like a log, a piece of wood.
Okay.
A piece of wood will move as a whole. There's no part that will move leaving the other. We can use any piece of wood that is firm that you have at home. If you don't, you can still use a carton box. The boxes that we have, use a carton box, then trim it nicely and use it to support the leg. So Barasa will demonstrate to us how we can put a splint.
Yeah, somebody to hold for me the leg, because we
I
need to
can
hold the leg
leg.
You can
nicely.
hold the leg.
Yes, from this joint also.
Okay.
Thanks, sir. We put it under. We ensure that our body is taking two joints. Then from there, hold it from here. Thanks. Then from there, we tie it now. From joint
All the way.
all the way to the other end.
Okay.
So with this, because this place was very mobile, could move very easily, now we are restraining its movements. It's not going to move.
Yeah.
And through that, we're going to minimize the bleeding, because that bone that might have cracked might even injure the blood vessels. Yes, and will
Okay.
cause a lot of damage. So you tie nicely with your piece of cloth or kanga or lace or anything.
Yeah.
Yes.
So remember, the essence of doing this, Linda, is just to make the leg firm.
Firm,
Yes.
yeah.
So that the fracture is not able to move on its own as you wait for the medical team to come. So that will also sort your fracture. Remember, we have also sorted our bleeding. So our child is getting safe. The only thing that is remaining now is, you know, sometimes a vehicle has crushed their leg and probably even they are amputated, like the leg is totally chopped off. It's a scene that you don't want to see. It's really scary. But remember, they are bleeding so much, they are likely to die if you don't do anything about it.
Yes.
So sometimes we encourage something called a tourniquet. A tourniquet is just, you want to tie, you remember a long time when people had snake bites?
You tie
They used to tie it
somewhere
so tight
Yes.
because they don't want the
Yes,
poison.
yes.
That's the
Even though
poison
it's a
to
wrong
spread
practice, yes, but we
the
can do
rest
it
of the
because
body.
now in trauma, when the leg is cut off, we want to save that bleeding. So we want to stop it. Now we will
you
tie.
tie,
Yeah, it's always good to tie above the knee.
The knee.
Okay. So when you make a knot, because you really want to make it tight, remember they are bleeding. The leg is already gone. So you tie it, okay? Then use a firm thing, a stick, a piece of wood, a piece of metal, tie on that cloth, then start rotating.
Yes.
So this, you can come and feel it. As you rotate it, the piece of cloth gets tighter.
Yeah.
Okay?
Yeah.
So when it gets tighter, then it remains somewhere. Then now you can lock it either on a piece of metal or
it becomes
someone
very
can just
firm,
hold it.
yeah.
So you rotate it until you see the bleeding stopping. Then now you know you have actually arrested it.
Yes.
Okay.
So this child will not bleed to death. Now, if we have preserved their airway, they are now breathing, okay? We have managed their bleeding, they are not bleeding anymore. Then the next thing is make sure they reach the hospital as soon as possible.
yeah.
Or the medical team should come. The ambulance or any other medical response should
be
come
there on
as
time.
soon as possible. Yes.
Awesome. Turning him and all that, carrying him up.
Okay, so once we do that, remember there are sometimes when there are injuries at the back that if the child is lying, if little Junior is lying the way he's lying now, we are not able to see. So it's always important to turn him so that you can just see if there's any obvious bleeding at the back.
Yes.
If there's blood coming out from the back, you will still use the same principle, pack it. But then in turning them, we want to demonstrate how to turn this baby.
Yeah.
Remember, we want them to move like a log. The whole secret with this is you want them to move the whole body at once,
Yeah,
not the neck moving or the body moving and the neck remaining. You want the whole body to move as a log. So we are going to demonstrate what is called a log roll.
Okay, so you need some help?
Yes, we need some help. We'll need two of you to come over.
Yeah.
Okay.
Linda,
So,
you can join us.
Same
You
here?
can place
Yes.
our
Okay,
baby
Baby
there.
Anne,
Baby Anne
please
can
feel
sit.
comfortable.
Yeah, just come.
Oh, Baby Anne.
Yeah, just join us.
So,
Please come and stand here. So, for me, I'll be able to support from here,
Yeah.
like this. Just hold, wait a little bit.
just upon the hand.
Yes, I will support this area.
Yeah.
Then for you, you will support here, and you put your hand inside. Just move a little bit. You put one of your hands, you stand like this, okay? Then for you, Linda, you'll come and hold it like this.
Okay.
Okay?
Only one
with
leg,
both
yeah?
hands, with both hands, only one leg,
Yeah.
like that. Then we are
turn
going
it.
to count at a count of 3. Then we roll.
Okay.
Yes.
Okay.
Then we can do that.
So remember, somebody should always be at the head to support the head,
To
because
support
we
the
also
head.
want the head to remain straight.
Yes, yes.
So the person at the head should now tell everyone, because he's able to see everybody.
Yes.
So on a count of 3, we are going to roll little junior towards us. Okay.
Yes.
1, 2, 3. Then we roll
Like
little
that.
junior. Then because there are many people standing by looking
can
at what
tell
is
whether-
happening, so they'll tell us if there's any obvious bleeding, then we can check. If there's no bleeding, then now we can put them. If we have a hard piece of wood, we can put it, or there's something called a spine board. We can demonstrate. We have one here with us, and I'm sure you have seen this several times out there when the medical team
You've left
comes.
little Junior.
Yeah.
No, it's
Just
good
for
for demonstration.
So this is the time we'll put slip the board under, just slip it, and then on a count of 3, we'll turn baby Junior, little Junior on his back again. 1, 2, 3, and then baby little Junior lies on the board. Then remember the safety belts. We will always buckle our child.
Buckle the baby.
Yeah, just like so. If we don't have these belts, we can use pieces of cloth to tie them. Yeah, on that board. Why this board is important is because
It keeps them firm also.
yeah. So this board will make you, when you transport this child, they are moving like a log.
Okay.
So the neck is protected, the legs are protected, and your child will always be safe.
Safe.
So this is the
Ooh.
time to put your child in a pickup or in a car or in an ambulance if the ambulance is already there.
Yes.
Awesome. You know, the little things that we ignore, you know, the small, small things that would be used to save the lives of our children in case of an accident. Well, we are headed to the, I hope you've learned, by the way, wherever you are at home and everything, this is a great lesson. It might look like it's something hectic and all that to do, but trust you me, it is worth the fuss. We're headed to the Christmas season, festive season. We know that this is the moment where we have lots of accidents out there and everything. As we wind up the show, what would be your word, you know, to the people out at home? What is it that you would tell them that will help them, you know, help reduce the losses of life out of accidents, or maybe reduce the number of accidents now that we are supposed to be enjoying and having fun and not mourning?
Yeah. Me, what I can say.
Yeah?
Yes.
You got them, yeah?
Yeah. What I can say is all about safety to this child. Please take care of your child at this time. Don't forget your child. When you're going out to have fun, don't forget all the principles that maybe we have learned here. Please take care of your child. That's
Awesome. As we get to wind up,
Okay.
last words, you know.
Last words are, we always want our
Of course,
children.
not last words, like, you know, not last
Yes,
words.
to wind up this
To
show.
wind up this
Yeah, we always want our children to be safe.
Yes.
So safety is very important. When you go back home, make sure your first aid box are well equipped.
Yeah.
At least your caregiver or someone is trained on first aid.
Yes.
Then number 2, when these things occur, when these accidents occur, make sure you have those basic principles
Yes.
to manage this. Like we said, a child who has been involved in a crash, our worry is, are they breathing or not? Then if there's bleeding, we need to control those bleeding. If there's fracture, if they're broken, we need to make the fracture stable. We need to put a piece of wood to protect them. Then we need to make sure they reach the hospital as soon as possible. And our goal is let's observe speed limits as we go home over Christmas. Let's have seat belts for our children. Okay. Let's drive during the times when there's clear visibility, and let's always accompany our children whenever they are on the roads.
Yeah.
So that everybody who comes to our country will know that we love our children, we care for our families, and we don't want any child to cry unheard. We want to listen to these children.
Reminds me of how mom used to tell us, clean the house when visitors are coming. Well, we're not doing this for the visitors, Pekeyake. It's all about us. Make sure that we take note of the simple steps that we've been shown today, and I believe that we are going to reduce the number of deaths out of road accidents, and of course we will actually reduce the number of accidents generally. Thank you so much for having time to be with us. Until next time, I'm Linda Alela Makambu.